I have the challenge trial, Paul.
Again, it depends. What does challenge stand for, Nora?
Oh
No,
my
looking at
gosh.
it here, colon health and lifelong exercise change. Boo. Boo, boo to
Yeah, I know.
oncology.
I know. Okay.
Focus
Well,
on saving lives.
yes, they can improve upon this one next time. But this is a study that just was published in the New England Journal by Cornea et al. And was the talk of ASCO this last 10 days ago. And this study looked at exercise and the risk of cancer recurrence, specifically in colorectal cancer and actually overall survival. This is a randomized clinical trial, and it is trying to address a question of great interest that has been the source of many different observational studies focus. And this is whether or not exercise can decrease your risk of cancer. The study challenge was a randomized phase 3 study comparing a 3-year structured exercise program plus health education materials provided to health education materials alone. This was in patients who had early stage but higher risk colorectal cancer. And so these were patients who had either high risk stage 2 or stage 3 colon cancer. They had to have gone through surgery, complete resection, adequate resection, and then also had to have finished adjuvant chemotherapy within the prior 2 to 6 months. And if they were eligible on those bases, and if they had an ECOG performance status of 0 or 1, and were able to exercise in kind of moderate to vigorous ways, they were randomized to either the structured exercise program for 3 years or to these health education materials. So yeah, this study got a lot of headline activity over the last 10 days. You may have even seen it. The primary endpoint was disease-free survival, and one of the primary secondary endpoints was overall survival, and they did see a benefit in disease-free survival in these patients with exercise. So you had improved disease-free survival if you exercised on this structured exercise program compared to if you were randomized to the health education materials alone arm.